Welcome to News at 9 with Anna, Megan, and Sarah. We just got an update on India's health and education.
There has been a recent increase of availability of HIV medications to citizens. Now to Sarah with more details.
Recently, 25% of people in need of HIV and AIDS treatment can obtain it. This is very important because 0.3% of India's population is infected with HIV. That is
About 4
million people in India infected. The government has tried to control the growth of the HIV-infected people by setting up AIDS prevention and control societies in each of India's states. These organizations go around to educate people on preventing the spread of this disease and other diseases that are detrimental when having HIV, such as tuberculosis. These programs also allow more accessibility to medications for treatment that the healthcare system in India does not cover. On to Anna for more information about India's healthcare.
The healthcare is improving each year, but there are still many problems that the government has to fix. First off, the government only does the minimum amount of help and investment into their healthcare, so that creates a vast gap between the poor and wealthy type of healthcare. The wealthy has a healthcare that allows them to be updated on their shots and any other health problems, while the poor has a lack of proper and beneficial healthcare. That's not all. Without funding for the hospitals, they are unable to be equipped with the proper tools and staff to take care of the patients. There is 48 doctors per 1 million persons. The doctors aren't the only staff that the hospitals are short on. There is a large shortage of trained nurses. With the improper doctor-to-patient ratio, this affects the care of the patient. Not just that, but many of the workers in these health clinics or hospitals do not have a medical degree, which then later affects the reliability of India's healthcare system. And now to Megan talking about India's education.
The lack of doctors with medical degrees starts off with how they're educated as children. There are many flaws in their education system. For starters, their teachers are not trained as well as they should be, and they have a very hard time teaching the children. While we were in India, I observed a classroom at a school. The teacher teaches grades 4 through 9 and said it's very hard to teach because of the different levels of learning. Most of the teachers do not study past the 12th grade, so they do not have a great background to teach on. Most of the time, they don't even know what they are talking about. The language barrier is a problem as well. The students and teachers both struggle to speak English, so it is hard for many students to get a higher education. The government is trying to improve the education. One thing they did was have a midday meal. By doing this, the enrollment increased by 20%. They also have a Right to Education Act where the children ages 6 to 14 have free education. These things and many more are improving the system, but there are still many problems in it.
With health and education in India improving, it allows for a better life for individuals. When more people are able to obtain medicine for their health complication, this allows a better quality of life and a higher life expectancy. All of these problems in the healthcare system are affecting the health of the people in India. The poor are unable to get the proper medication and care for their injuries and illnesses. Lastly, the improving education will help India in the future by providing students with the right to an education and to improve India's status in the world as a whole. For the whole newscast team, thank you for watching. Have a good night.